Hey guys, it's Miss Reyes and Miss Ratcliffe, and we're going to show you the IM sites so that way you can identify them a little bit easier.
This video is also going to go over IM injections and your ampule. So first we're going to talk about the sites and then we'll move into the skill. All right, so I'm going to walk around here. Miss Reyes is going to show you where the deltoid is on me and how to find it.
So I'm filling for her acromion process, which you can fill it right here. And then I want to go to the lower part of her acromion process. And your book says between 3 to 5 centimeters, but you always have to look at your patient, because if I were to do 3 to 5 centimeters for Miss Ratcliffe, I would probably go a little bit too low in her arm. So I'm going to use about 2 fingers, fill the bottom of her acromion process, and then I'm going to come, let's see if I can move to this side, and I'm going to make my V. The injection should go right about here on Miss Ratcliffe. Does that feel comfortable?
Mm-hmm.
Okay. So that's how you'll find your deltoid injection site.
And remember, your acromion process is a bone, so you're filling for a bone, okay? All right. So there's 2 other areas that you'll see injected. So the vastus lateralis is the other one, so we're going to show you the vastus lateralis.
Okay, so vastus lateralis, you're filling for your rectus femoris, which is right here in the center of your leg. And then you come over to the side over here, and this is going to be your vastus lateralis. We typically use this a lot for infants, especially if they're not walking yet. We'll use this vastus lateralis. So when they're getting like vaccines and stuff, you'll see that a lot in the doctor's offices where they're using this side right here. So you find your landmark of your rectus femoris right here, and you slide over to the side, and this is the vastus lateralis.
And when you're doing this, you're not going to want to go like high or low. You're going to stay in the center. So what we usually do is put your hand here and here and go somewhere in the middle, because you're not going to want to inject high or low. All right, and then the last one, let me get this for you. Would it be easier if you held it?
Probably. Okay, guys. So this is the ventrogluteal that you're going to be doing your IM injection on. So when you have these skills trainers in the skills lab, be sure and put your hands on them and feel them. You can feel right here, this is a bony prominence. It's meant to mimic the greater trochanter. So you want your palm to be right on that. If you look, this is the patient's bottom. This would be the groin area. Your patient's head would be up here, and the legs are down here. So you're putting your palm on that greater trochanter, and you're feeling for that iliac up here. I have very small hands, so if you look at my hands and Miss Ratcliffe's hands, if she put her palm right here, she'd probably be able to feel the very top of that iliac up here. So you want to make sure that you could feel the top of it and also feel the palm on the greater trochanter. So I have to adjust just a little bit. So your thumb always goes towards the junk, okay? Remember that. So your thumb goes towards the groin, and then your index and your middle finger are feeling for the top of that iliac crest, right? So when you find your location, you're doing like this, and it should be right here in the center, okay? That's where your goal target is, and you can feel I'm right in the middle of these 2 bones. Right?
That's a muscle right there.
So this is a muscle. So this is the ventrogluteal site that we use on patients. And dorsogluteal is no longer evidence-based just because they have that big, large nerve that runs in the back. I know you may go to some offices and still see this practice being done, but evidence-based practice is telling us to move more to the ventrogluteal because there's less risk of damaging that sciatic nerve in your patient.
All right, so now we're going to move into the skill of withdrawing for an ampule and an IM injection. So Ms. Reyes has already showed you how to identify your sites, and make sure you know this when you come in to do your skill. So first, we're going to review our healthcare provider's orders and medication administration record for the correct patient, medication, dose, route, and indication. We're also going to look at our drug book, make sure we know all the things about the drug. We're going to assess for allergies. We're going to look at our body type, the amount of muscle mass, the size of the muscle, the weight of our patient. And we talked a little bit about that just a minute ago when we were identifying our sites. Make sure you've selected the correct medication in the ampule, checking the medication's name, dosage, strength, dose volume, dose route, and its appropriateness. So these are all of those checks, right? We're doing our 8 medication rights and our 3 checks. So we're going to go ahead and wash our hands. All right, so Miss Reyes has gathered her supplies. She needs a needle with a syringe for her injection. She also needs a filter needle because we are drawing up with an ampule. She needs her ampule, which will have her medication in it. And we have an ampule breaker because we're going to show you that. And we have some alcohol. All right, so Miss Reyes is going to go ahead and wash her hands. All right, so she's going to attach her filter needle to her syringe. Now, her syringe already has a needle attached. That is going to be our injection needle, which we want to leave in the package. So she's going to leave that in the package, nice and clean in there. Can you show them what this filter needle looks like, what the outside looks like, real quick? Because I know a lot of students were getting confused. This is what your filter needle looks like, and it says filter needle on it. Okay, so she's going to go ahead and attach it. And why are we using a filter needle? You can think about that for a second. Because we're about to break a glass ampule, and glass can come down inside the medication, and the filter allows you not to pull that glass up. All right, so now that we have our filter needle attached, we're gonna tap the top, of the ampule and make sure there is no medication in the top. But guess what? Ours has a lot in the top, so we gotta get it out.
Tap the top. You can also swirl it.
Okay, you can see how it came out. All right, so now that our medication is all in the bottom, we're gonna hold the ampule below and away from the face. We're gonna either wrap a sterile gauze pad around the ampule neck, or you can use the ampule breaker, and we're gonna snap the top off towards self so that the ampule breaks away. Okay, so you're breaking it away from you.
Okay, so I just placed it. You heard the click, so that means that it's stabilized and in place. I'm not going to go this way. I'm going to break it this way.
Okay, so it broke away. So be careful with that top because that has glass in it, so that needs to go into your sharps container. All right, so we're gonna place the ampule on the counter, holding the ampule with the non-dominant hand, tilt it slightly, and we're gonna insert our needle and our filter needle into our ampule below the level of the liquid without contaminating. So we're being very careful. I'm gonna zoom in here. Oops, sorry y'all, that was kind of...
You can see that the needle, I'm just lifting up so you can see. You can see that the needle is in the solution. And it's always gonna stay at the level or below the level of the solution line. So I'm gonna pick it up so that you guys can see it a little bit better. You see that?
Okay.
I'm done with this.
She's gonna throw that away. All right, so we need to ensure we have the correct dose. I think that ampule had 2 milliliters in it, so it would depend on what medication we were giving, but we need to ensure that that is correct. So we're gonna go ahead and scoop. Okay, make sure you're not contaminating when you're doing this, okay? So we're gonna check their syringe for air bubbles. If bubbles are present, we're gonna tap the side to remove them. Then we're gonna remove our filter needle and attach our injection needle. Again, we're keeping all of these connections very sterile. So this is aseptic, so just the connections are sterile. All right, so she's got her injection ready to go. All right, so once we get to this point, you are going to label your syringe with the drug name, dose, and the patient's name and the time. You're also going to do that last check. Make sure you have the correct medication, the correct route, all those things that we've already talked about. So we're going back into our patient's room, and we're going to wash our hands. We're going to identify our patient, of course, checking with our MAR about that medication again. We're doing those 3 checks. All right, so we're gonna select the correct site for injection and don gloves. So Miss Reyes has a really cool trick she uses to identify it. So we have already talked to our patient and educated them on what we're doing, what kind of medication this is, and we're giving them an IM injection.
I'm just gonna fill again, so I'm filling for that greater trochanter. I know that I have to adjust because my hands are a little bit smaller. So I'm just gonna feel and make sure I'm not on any bony prominences.
And like she just said, make sure you feel. If you're hitting a bone, you are in the wrong spot, okay? So we're gonna clean with alcohol, and Miss Reyes actually puts her a little mark to where she knows where she's going to inject at.
So I know that this little triangle is like an arrow pointing to the insertion site, but I'm not putting it actually on the insertion site. I'm bringing it down some, but it gives me a good visual of where I know I need to inject my patient.
So now that our area is clean with alcohol, we're gonna let it completely dry. We're gonna remove the needle cap with our non-dominant hand by pulling it straight off, being careful not to stick ourselves. We're gonna spread the skin taut over the injection site using the dominant hand, holding the needle so that the bevel is up. Now you stick at a 90-degree angle with the swift pierce of the skin. Make sure you tell your patient you're about to stick them. You're looking to go into the muscle.
Big stick.
Okay, so once you're in the skin, you're going to secure the syringe with the other hand while aspirating. So this will depend on what drug you're giving. When we aspirate, we're just checking that there's no blood in there. And then we're going to inject slowly, no faster than 5 to 10 seconds per milliliter of medication. Once we're done with that, once we've given all the medication, we're going to swiftly withdraw the needle at the same angle used to insert it, and then apply a gauze pads to the site of with the non-dominant hand as soon as the needle is removed. So we're disposing that needle in our sharps container. We're going to avoid massaging the area. You need to make sure you activate your safety device if your syringe has one. Remove gloves, wash hands, clean up your area, and observe the injection site for bleeding or swelling or any signs of adverse reaction. If this is the first time your patient receives this medication, you would need to monitor them for at least 15 minutes after the injection for signs of adverse reaction. Make sure you document this in your MAR and your nurse's notes, and let us know if you have any questions.